Good morning and welcome to this morning session at the COVID Communication Center. Today, the Minister of Education, Nghipondoka, will talk about the logistics around the reopening of schools next week and how to ensure that all learners will have equal access to education.
Yeah, so far we have tested about 338, but this includes retesting for those positive ones. The rest of the figures is tested by NICD through our complementing lab, PathCare, and we are doing well. We are ready. As of today, we have a capacity of being able to test about 2,000 tests as we speak. But as we move on, if our suppliers delivers according to schedule, as of this week, end of this week, we are able to have stock to be able to test between 20 and 30,000.
Where is this stock coming from? You're saying if? So it's dependent on if you get supplies?
Yes, we have suppliers all over the world. We procure on emergency basis from identified suppliers in South Africa, in Europe. So we have orders placed as we speak, and we have expected delivery dates, and they spread from this week up to end of the month. We are building capacity in terms of, we are using currently auto or semi-automated methods as we speak. And this makes us have a turnaround time of results about 24 to 48 hours from the time of collections. Some specimens, of course, are coming from outside Windhoek, but it's still within the same turnaround time. Towards the end of this month, we are expected to move into a more automated testing methods because we are ready. There are equipments already in our laboratories which are automated, but we are still waiting for the delivery of the reagents so that we move over to these testing methods. Some of these testing, one instrument can run 470 tests and in 24 hours. So if we have 3 of these, which we shall have, we should be able to run 1,410 tests in 24 hours. And some of these test instruments are also already, we are using them, for example, for TB testing. These are the gene experts. We have a gene expert in every lab. But our rollout plan, of course, will be determined by the number of cases, either suspected cases or as the Ministry of Health decides whom to test. So we are moving towards meeting the demands as events.
Good morning, Namibia, and welcome to the COVID-19 Communications Center 10 o'clock update around COVID-19 in Namibia. This morning, we're talking about education and specifically about schools opening on the 20th of April 2020. And to help me discuss that, I'm joined by the Minister of Education, Arts and Culture, Honorable Nghipondoka. Thank you very much, Honorable, for joining us, and welcome.
Thank you, Honorable Emma.
This morning we'll also have a health update, but we'll do it at the end of the session. But we go straight into the discussion around education. We have seen all your questions and queries around schools opening on the 20th, and therefore we deemed it necessary to have this sectoral discussion again here at the COVID-19 Communications Center. Therefore, Honorable Minister, perhaps you can kick off the discussion. 2 days ago, His Excellency the President, Dr. Hakaji Geingob, announced the extension of the lockdown to the 4th of May. Before that, schools were going to open with the assumption that the first part of the lockdown would have ended, but now there's an extension. How has that affected the plans of the Ministry of Education in opening the schools?
Thank you so much, Honorable, for the question and for the opportunity to clarify issues. We are inundated with a lot of queries and people needing to understand what is really happening. The original stand of the ministry was informed by the fact that we are on holiday. I would say we are on holiday up to tomorrow, which we had brought forward from between April and May to run concurrent with the first lockdown, while avoiding losing contact time with the teachers and learners. We had informed our teachers that come 20th, if the lockdown is out, over which was supposed to be yesterday, tomorrow, they would still be at home, but be duty bound. They would still be working from home, but active in a way that they can, while observing the World Health Organization health protocols, they could still move from home to a school where you feel I'm safe and do something at school, or you can do it at home. You can start communicating with other teachers on the available platforms. That was the stand. But with the current extension, which is extended to the whole country, which is affecting where our teachers find themselves now also. There is some similarities on what we said before, but then there are also changes which might affect the way forward of what we wanted to do with our teachers. The extension now says the lockdown is now countrywide. Wherever you find yourself tomorrow at that time, stay there.
Do not move.
Do not move. And this is informed by the Minister of Health's elaboration, which he did so concretely, elaboratively on the day that the President, His Excellency, announced the lockdown. He was given an opportunity to say why the extension. And if you looked at him, listened very carefully, what he was saying is to say there is a need for the Minister of Health to be able to have a focused control of the spread of the virus, and thus everybody is required to be where they are. What does it mean? Does that mean to our teachers now? We have a staff component of more than 30,000 teachers. And these 30,000 teachers, wherever they find themselves today and tomorrow, is where they could have gone with the thought of coming back if the lockdown could have been lifted tomorrow. But now what applies to the whole country applies also to our teachers who are finding themselves in areas which we call not being their own duty stations, duty areas.
What does that mean?
This means you may find, even though the zones are not declared yet, we do not know, because the country is going to be divided into zones, which are still to be announced. But what it means is that this teacher may find herself or himself in an area which is far remote from the school where they usually operate, which is their duty stations. If, for example, it said you stay in one region and you are in Oshana now, and you teach in Erongo, it means for the next plus minus 2 weeks, from the tomorrow to the 4th of May,
Yeah.
stay where you are. Even if you are teaching if you are teaching in Erongo, you stay in Oshana, you are there now, stay there. How does it affect now what you were saying? What remains the same is to say, teachers, wherever you are, stay duty bound. Do something. The holiday is over. Our holiday is over tomorrow. Stay at home, stay where you are, do something on learning. Start looking at your daily preparations, start communication on or with other teachers on available platforms. We'll still talk about that one in length. Start doing something, but remain there. Because what that means is, as I said, we have a component of more than 30 teachers, 30,000. If you now say, teachers, for us to make it easy for you, you should be allowed to move and stay at least in your area of duty, kind of duty station. This will mean you will have 30,000 plus people moving. Because if you look at a family, maybe husband and wife and 4 children, you will take 30 plus 4 times 30, if you can calculate it like that. Although not necessarily may all the teachers would like to move.
Yeah.
We lucky enough, we are likely to capitalize more on the teachers who find themselves now in their area of duty, close to their schools, in their regions, whereby you could say, while observing the World Health Organization health protocols, see what you can do within the vicinity of your school. The principal can go to school and say, my teachers, come over, we need to work on the school preparedness before the children return. Because what we are saying is, as much as we are saying, come 20th, holiday is over, teachers are on duty where they are, they should now move from the mode of holiday into the mode of work from home, like all of us has been doing.
Okay.
The learners, we are saying, learners stay home. They stay home because we are still waiting to be informed further by the Minister of Health. That minister we have been given the power to direct this country and advise us on the basis of the expertise that they have. Is it safe now for us to say, children go back to schools? Why? It will be very difficult for us to adhere to the laid down health regulations with the number of children, which is plus minus, not plus minus, more than 800,000 learners. For them to go to the schools, in the hostels, in the classrooms, where they cannot observe all these laid down regulations. We rather have them safely at home while we are working on what we are saying, developing and enhancing online education resources together with our teachers, and I'm going to talk about that one at length because there are also questions. What do you do with everybody? Will this reach everybody? We with my team who are here today, we want to elaborate more on what is it that we really think would work and relatively help. We are talking about relativity here because we are in a situation where definitely nobody planned for it, and But we are in the situation where, as responsible citizens with a mandate, we cannot just say we let go of everything until such time the pandemic is over. We want to be doing something. So that's what it means.
All right. Now, Honorable Minister, you did mention, of course, the teacher's role, shifting from holiday mode to actually getting into a teaching mentality and phase to prepare for when schools will become operational again. What about the learners? They are staying at home. Would you also say the same, that they should shift from holiday mode to a learning mentality?
Very much so. Very much so. And I believe this will take me now to talk about, if we say learners and teachers switch from that mode now, start doing something. The main thing that we are talking about here, which will help us, is the online, mainly online education, activities to go on. And we were inundated with questions to say, you are talking about online. But we are not only talking about online, we are talking about multimedia way of reaching the children.
Okay.
Let me start to say, the Minister of Education, when we are talking about online doing things, or what we call OER, which is online education resource distribution and accessibility, we are not starting afresh.
Okay.
We are just saying we are enhancing what we have already started. Education has got some institutions which are offering open learning. And our main institution is NAMCO. In NAMCO, we want to capitalize more on what NAMCO has started because of the nature of education that they offer, which is open learning, where they need to reach their students wherever they are. NAMCO, since 2013, they came up with an initiative which is called Notes Master, Namibia Notes Master Initiative, whereby teaching learning materials are developed by teachers, made easy for students to understand, whereby quizzes are done, multiple choice questions, and all assessment materials are prepared, and then it's uploaded on the system, and it's shared across by the students. And mind you, NAMCO uses our own teachers, which we have in our mainstream schools. These materials literally are developed by our own teachers.
Okay.
So, what are we saying now? We are saying with Notes Master, we want to expand. NAMCO usually concentrated only on senior secondary, mainly, grade 10 and 12, because this is the examinations they used to offer. But now we are saying, in this situation, we need to immediately, and we have already started working on. And before I even forget, I would like to mention that many of our teachers are already on board, from primary to secondary. They are saying, we have been producing material online already. We have got banks of materials developed already, which we can share already with other teachers, with our learners. So, now what we are saying is to say, we are going to enhance and strengthen and expand on the material development.
That already exists.
That already exists.
Okay.
And mind you, many of the materials that are existing are based on the old curriculum, which we call the legacy curriculum, although it's not necessarily so different from the revised one.
Okay.
We need to relook at those ones also and bring in the concepts of the revised curriculum. That's one thing. The other thing that we need to do on Notes Master is we need to increase the coverage of subjects, all the subjects to be covered. And with Notes Master, we want to concentrate more on secondary. Because I'm still going to talk about the other program that we have. Secondary, 8 to 12. Now what we are busy doing, and I'm happy to say our teachers are already on board. We are identifying expert teachers. Some of them are volunteering. Come the 20th, across the regions, we want to come up with what we call, or maybe identify some schools, resource centers, as material development hubs, where you can say, our teachers in small groups of subjects, they form subjects groups, they are already online, communicating with each others. Do whatever you do, either at home, or you may say, we come together at a hub and develop materials, look at the subjects like mathematics, look at what are the key concepts, how do we teach them, and then these are uploaded, and then this is quality assured by our education officers, both in the Ministry of Education and NAMCO.
Okay.
And then it's sent forward to all the teachers now,
All right.
which is really a thing that brings us together as a community of learning. It's not a matter of now anymore, I'm sitting at my school, I'm doing my own thing alone. Yes, you do your own daily, even if after COVID. This is something that we are so much excited about, because we are going to break the silos. We are going to break the isolation of the teachers with this one. Now, the question will remain, but how do you reach every child? We know that there are, especially if you look at secondary schools, many of our children have got cell phones. And teachers can reach their own children. They can identify them. And I will still ask one of my, the Deputy Director, IT, to explain how Microsoft is helping us to bring all the programs we have together and make the accessibility possible. We have got many stakeholders on board already. Microsoft, NBC, MTC, Telecom. You know, we are working on reducing of prices for data, you know, the issues of connectivity, although connectivity is still a problem that I'm going to talk about, which Telecom and us has been working on all these years. But we are saying, for the children, we know that not all of them have got cell phones, not all of them have got tablets.
Yes.
Not all of their parents have got cell phones or computers, although the majority, many of them has, but we are concerned more. And our emphasis is to say, don't leave any child out. So what we are doing is, with our materials developed, we are going to pull those out, download them, print them out, especially now, this brings me to primary education.
Yeah.
With primary, we want to use our Kopano platform. Kopano is a teacher's virtual platform where our teachers are communicating with each other concerning their subjects. They exchange ideas, best practices. They exchange even lesson plans, how to do things. Now we want to ensure that all our teachers make sure that their children, students, are also registered on Kopano. Those that have got accessibility to technology gadgets, which can enable them to get access to the online information.
And those
But
who
we have
cannot?
got lower primary, especially from grade pre-primary 1 to 3, those ones. We are saying, our teachers, again, are trained thoroughly on development materials. We have got a big pool of those teachers. Many of them are already on board also, especially our primary teachers. They are coming to say, we are trained, we have the facilities. Some of us, we have already uploaded the information, we need to share it. Our teachers, after having those information uploaded, we want to print it out, and then, having printed them out, we come up with something that we call learner packages.
Okay.
Small packages packaged according to competencies. Simple ones, which parents can use with their children at home. Mind you, our lower primary is taught in their vernacular. If you take a school in Ongwediva, where I come from, and you have got a hub of teachers who develop those materials, we take these materials, we work with the counselors, traditional authorities, all the structures down there, the whole system of government, we say we have all these packs to take to the children at home for them to sit with the parents for coloring, and we will use the grants at schools. That's why we are saying at least teachers should be active now.
Yeah.
Even though teachers may not find themselves at their own duty area, a teacher is a teacher. Education, it seems my...
You can use the mic.
yeah,
That's fine.
I'll put it back.
Okay.
Fine. We are saying even the teachers that find themselves in areas which is not their duty areas,
Yes.
if with the coordination of our directors of education, our inspectors of education, the system is so much decentralized. They can still come together with all the other teachers there, while I will always come back to the issue of observing health, health regulations. They print out these things, send it to the learners. And we are saying schools now, this which will bring us now to the issue of principals to be around and communicate with their teachers and communicate with the directories and everything. We are saying a network of communication should be established to say, principal, we want money for maybe crayons, whatever that could be bought or that could be, we will see how it can be arranged.
And that will be put in the learner package.
Yeah, in the learner package.
Okay.
So that when they go home, and we also urge our parents, would you receive a learner package without enough or whatever you need? Do something and get access to wherever you can get it. We want them to be learning numbers, colors, those basic things that they used to do according to the content, according to their syllabi. The teachers we are using are our own teachers who knows. At this time, these children should be learning what. So to answer the question of how do we take care of these children from grade 0 to 12, we will be able to at least maneuver, and specifically for the lower ones, because they are the main ones that you find usually in the rural areas, deep in the rural areas. We are trying everything we can. We may not be able ultimately to reach everybody, but the aim and the target is for us to make sure that at least our children are reached with that one. And that will be mainly done by Kopano. Kopano is, as I said, our own, the Ministry of Education, Arts and Culture platform for teachers. And it's being managed by our own education officers from head office to the regional offices and our teachers.
Okay.
So we have a community already which is busy doing something, and we really at this juncture, Honorable, allow me to really thank our teachers. For those that are positive thinking, forward thinking, innovative, initiative. My ED told me this morning he was sent something already by a teacher at 4 o'clock in the morning. For her just to see on the email, a teacher has already sent materials that he developed since 2013. Meaning teachers, we have been there, but underground. Now these things are coming out. And when it comes out now, it's not that it has never existed, but we are saying we want to enhance that the concept of online education resource development for us to have a bank, a depository for the country. And this will also help everybody else, not only children at schools. Open learning, non-formal education will benefit, informal education will benefit, formal education will benefit.
Okay.
All our youths will be exposed to this, and this is now in the long run.
All right.
What we are starting now, as I'm saying, we are capitalizing on what we already have to quickly enhance it and send it out, but we are building on the future for us not to go back again.
Okay.
Yeah.
Honorable Minister, just to summarize a little bit before I ask you my last question around school preparedness. What you're saying is that one, teachers, now that the extension of lockdown has been extended to 4th of May and to the whole countries, teachers must remain where they are and use their existing or networks to be created to work with other teachers, with their school principals and directors, to continuously develop material that will be put online on online platforms for parents and learners that have access to mobile phones and electronic gadgets. But for those who do not, the material developed will be printed and learner packages will be developed from grade 0 to grade 12 and made available to those learners and parents at home.
And our
Yes.
priority, to correct, our priority, especially for learner packages,
Yes.
we want to focus more on
Primary.
primary.
Okay.
Because these are the ones that we usually find that they may not have everything. To the other higher grades, we will see
Yeah.
if the need arises. Because definitely those ones are easily traceable by their teachers, and many of them are already in communication with their
Okay.
teachers.
Okay.
But that's the plan.
Okay, all right. Now that's clear. I would like to ask about school preparedness. Post 4th of May, should there be no extension? What are the plans, or how are schools becoming prepared to, first of all, also continue these health guidelines which have proven to be doing well to contain the virus, but just generally post COVID-19, and now that these measures have been put in place, what would be school preparedness be afterwards?
Yeah. To start with, maybe I should enlighten about something that I didn't mention. It's the fact that on the 6th of May, with the understanding and belief that we will be well and the lockdown will not be extended,
Yeah.
we will expect our teachers to be physically now at their duty stations, meaning the schools. Why? But about the learners, we are still saying, even if we are told now the lockdown is over, we will still rely on the Minister of Health to say, Minister of Education, now it's safe. Your children can come back to school. But what we are busy working on, in fact, we have already done it and presented it to Cabinet. It's being looked at to the Ministers' Committee, Economic Committee, and the other ministerial committee, which is chaired by the Prime Minister. We have already, together with the Minister of Higher Education, aligned the programs, which is ensuring that come end of COVID, definitely we should be able to say we already have a plan to say when do we start schools. The calendars are adjusted, but then that one will still be informed. We cannot go out with it and say this is what we think, because then it will still bring confusion. We are still discussing it. Yeah. Learners, teachers will come back to school on the 6th physically.
Yeah.
Why? We want to embark upon, continue to now again. One, we will continue with the proper e-learning, we will continue with doing whatever we have been doing while they are now at schools. Secondly, we need to look at the preparedness of the schools in terms of hygiene. In terms of hygiene, do we have sanitizers at schools? Like when I came here, everywhere you go, sanitizers. Do we have enough cleaning materials at schools? And everything that will ensure that the school is safe. One thing that is killing us, and which we are busy trying to see if we can get help, is the issue of sanitation facilities in our schools. Water, some schools don't have running water. We are busy scratching for funds to make sure that schools at least have got water tanks, those that don't have running water, for us to make sure that come the relatives are back, at least they should be able to wash their hands. They should be able to have soaps at schools. The issue of ablution facilities themselves. We have got schools with ablution facilities which are not functioning properly. Some are not existent, some are pit, some are, in some with flashing. But we are saying we want to be looking into all those things, and for us to be able to effectively roll out whatever comes from the regional office through the head office to regional office to schools, there must be principal, management, teachers, institutional workers, matrons to make sure that the tables in the dining halls are cleaned, are sanitized, everything. If we need to fumigate, things are fumigated before the children come back. Those are many of the things that we need to do. While we are saying teachers, especially principals, and everybody must be at schools, is to say we are going to use the funds that are now in the schools. We are already busy having instructed our directors to say we need to make sure that we don't get a principal telling us that there is no money in the account. Because this is what we have realized. Something that is so painful, we send money to the schools, and you discover a school with 500,000 in the account. And
Not
yet
doing anything.
And yet, yes, and that the school is telling parents to go and buy stationeries. That's why, in fact, this one I discovered when I went around the regions, and I said, I instructed my AD to say, tell your directors, we need to get those accounts, pull them for us to see where there is money, so that we can use that money for us to buy everything that we need for the schools to be ready. That's why we need our teachers physically at schools to do academically, they embark on whatever they do, hygienically, they prepare the schools. So that by the time that Dr. Shangula says, my dear Madam Nghipondoka, send your children to schools. Anytime, any day, we can say the schools are ready, children go back to the schools.
One last one, and this we got from our email address that we asked the citizens to ask questions, is that some are of the view that social distancing should continue to be a norm to be practiced. Of course, knowing the nature of learners at the school. We have issues of classrooms that might not have the facilities to allow that provision to happen, but also the interaction of children at the schools. Would that be a challenge the ministry and the schools will have in ensuring that children practice some of these health guidelines that continuously are being asked to be practiced?
Very, very, very much. If there is any health practice that one would say will be, in fact, impossible in our schools, is the issue of social distancing. In the first place, the standard size already of a classroom with a normal ratio of either 35 to 30 per teacher, it cannot allow really 1 meter. It's usually maybe half a meter. They are close to each other's. That one is even exacerbated by the fact that many classrooms are overloaded. We are over the numbers that are supposed to be in the one class. Instead of having 34, you have 40.
So overcrowded
Overcrowdedness. So that one is not easy. Secondly, the nature of children. You may facilitate it here in the classroom, and you say it's break time. Go and play. What will happen? They will still be fighting and, hugging and doing everything. You can see what is happening already now. And this is something that I want to bring to the attention of the parents. Children are all over. Yesterday I was looking at the news. Children are all over the streets. They are going to fetch water in groups. And the children are not at home, hidden, protected. And that's a fear. That's why we are saying, rather, we may tell them to sanitize the words, to educate them not to touch their faces, their little faces. But there is a lot that you cannot do with a child. That's why we are saying, remain at home. Their lives are precious. Their lives are so precious. We cannot just make a mistake. Let them rather be at home. Teachers come on the 6th, because us as adults, me and you, we know we can distance ourselves, we can, greet by, even if you want to hug, no matter how much you want to hug, you don't hug, But that you cannot do with the children. That's why they are staying at the children. So there are those challenges, including the other ones that I mentioned first, to say facilities are not really enough. We have a backlog which we are working on to see how what mechanisms do we put in place to make sure that we improve on the number of classrooms, ablution facilities at schools. We are looking at other ways of doing things in order to alleviate that. That's a long time plan. It cannot done within this month or two that we wait for the children to return to schools.
All right.
Yeah.
Thank you. Thank you very much. All right. Before we give the media an opportunity to ask you questions, Honorable Minister, I would like to invite Dr. Sioben Kandetu to give us a health update around the health sector and COVID-19 in Namibia. Dr. Kandetu, the floor is yours.
Thank you very much, Honorable. Just have a brief update from the Health Ministry. Good morning to everyone. We have 16 confirmed cases, though that statistic has still not changed. We, however, are very pleased to report one new recovery as of this morning, to make a total of 4 recoveries.
Very good.
Case number 14 had been asymptomatic for the past week and had tested negative on 2 consecutive occasions, 48 hours apart, and thus has been deemed to have been recovered. So this is very good news. We now have 12 active cases, no new confirmed cases to date, and also no deaths reported as of COVID, as of this morning due to COVID-19. More cases, more active cases have been tested, and we hope to announce more recoveries in the coming days. From the laboratory side, NIP as well as Pathcare have tested a combined 454 tests, 454 samples, and this number will increase significantly in the coming weeks as we have now scaled up our testing to include those who are in quarantine, irrespective of symptomatology. So what this means is, of those who are currently in mandatory quarantine, once they complete their quarantine period, which is a period of 14 days, irrespective of whether they have symptoms, they will be tested. To that end, we have about 81 people currently in mandatory quarantine facilities throughout the country. From the cumulative number of 346 people who entered mandatory quarantine facilities, about 6 of them were tested based on symptoms, based on the fact that they had symptoms, and their results all came back negative. But as I mentioned, we will be testing more of these people as they complete their quarantine. In closing, public is reminded to adhere to the rules and guidelines of social distancing and hand hygiene. And please make use of the Emergency Operating Center's hotline, 0800 100 100, for any COVID-related questions or queries. That's it from the Ministry of Health. Thank you very much and have a good day.
Thank you very much, Dr. Kandetu. I think we are very pleased to hear that.
Yeah.
So we now have 4 recoveries, up 1 from the 3, and so we only have 12 active cases and no new reported cases. Thank you very much for that good news this morning. I now give the opportunity to media practitioners here at the COVID-19 Communication Center. We have a gentleman there and a madam here at the front. We'll start with those 2 questions. The podium is right there. Yes, ma'am.
Good morning, Honourable Minister. Jana Marie Smith from Namibia Media Holdings. I wonder if you can say at this stage if there is any data yet available on how many of the more than 800,000 learners in Namibia have access to the internet and have electricity at home to enable them to do the online learning, and how many teachers who are currently not in their duty zones how many of them can work, or how many of them are in areas where there's also perhaps no electricity, no internet? Sorry, I have more questions.
Okay.
Then I also wanted to know these materials that you want to print and distribute to primary school kids. When will they be ready to be distributed? And do you have an estimate of how many packages you will have to prepare and distribute? You also mentioned that there are schools that do not have any running water. Do you have any numbers on how many schools are affected by this, and how many schools will have to be equipped with running water and functioning bathrooms? Okay, thank you.
Thank you very much. Honourable Minister, should we get one more question?
Yeah.
Yeah, all right. Sir, the floor is yours.
Good morning, Honourable Minister. She sort of already asked the question that I wanted to ask. Maybe I should just extend it more. My name is Samuel. The question that I want to actually, which is more an extension of what she already asked, it's actually the, you say you are more concerned about the primary learners and those that are in remote areas. When it comes to the materials that's going to be printed, how we'll make sure that the Ministry of Education, together with the regional inspectors, make sure that the material printed out is effectively, or has effectively reached those that are in those that are in remote areas, and to make sure that they're not left out. Thank you.
Thank you very much. I think those questions are clear. Yes, Honourable Minister, the floor is yours.
Okay.
Maybe I can also just announce we have Ms. Eda Bon, who is the Deputy Executive Director for Formal Education, and Mr. Johan van Beek, who is the Deputy Director for IT, who can assist with any technical questions and answers to that effect. Yes, Honourable Minister.
Yes, I be ready to answer some of them to supplement what I'm saying. But concerning the learners, we have been observing an increasing number of learners going online. By yesterday, I was informed that we have got plus minus 13,000 so far of learners who are on either Copano or Notes Master. But as I said, the majority are in commerce. The majority are in Windhoek. There are some plus minus 700 in Ongwediva apparently, and some in Omaheke. So it's a pocket of it's just a sign that they are enrolling. Concerning the teachers, the numbers have also grown. The last day, I think last week I talked about plus minus 9,000, but now they are more than that. The numbers are growing. The issue of how many teachers are out of their duty zones, we are busy trying to find out that one, and Ms. Eda Bon will talk more on that one. We have a way, one thing that we are busy doing is we have finalized yesterday directives to directors, to go to the directors to inform them how to practicalize what we are saying should happen, and give them ideas. One thing that should be noted is that everything that we are saying here, we did it in consultation with NANSO, NANTU, TUN. We sat together. And every decision we take, we make sure that we don't say this and unions come and say something else. We are speaking the same language, students are speaking the same language, we are in the same, on the same boat. So that's why I can confidently say what we are doing it together. And when we were working yesterday, the whole day people were finalizing the directives, having been, extracted from the inputs from our stakeholders. Because we send a questionnaire with questions to say, tell us, in order to run with the e-learning, the preparation of the schools, how do we do it? Make your own input. Even there, TUN and NANTU said there in that meeting. But unfortunately, NANSO was not represented. But we are saying, we are busy working out specific directives to go to the schools. We may not be specific with everything here. We will be giving principal ideas of what happens, and we may not be specifically to say how many are doing this, who are here, but the issue of what is the likelihood of us having many teachers away from their duty stations? We are doing that. But what we are saying is, as I said, education is education. It's decentralized. The same curriculum is the same curriculum. What is taught for a grade 1 learner in Oshakati is the same that is taught by to a grade 1 learner in Ochomuru in Kunene. So wherever the teachers find themselves, let them join the other teachers. Let them just continue doing something, and it should not be a deterring factor to say, since I'm not in my duty area, I cannot do something, I'm disempowered. And our directives will have clear directions to directors to say, directors, teachers are scattered. Many of them are there with you. They consider them to be your teachers now. Help them with whatever help they need.
You can use a handheld mic.
I don't know what this cutting is falling.
Okay.
But I think I can be heard. Eh?
Okay.
Okay. I think about specifics of how to ensure that learners are not left out, and the issue of what are the numbers of materials that we intend to print and when is it to happen. I would like to give over to our Deputy Executive Director, Ms. Eda Bond. Eda Bond is our Executive Director for Formal Education. She is the person who's dealing directly with schools, regional offices and schools and everything. Yeah.
Welcome, Ms. Bond. The floor is yours.
Honorable.
This morning.
Good morning, audience and viewers. The Ministry of Education, Arts and Culture has 1,920 schools. This includes about 150 private schools, and the private schools cater for about 6% of our learner population. Regarding the schools that have access to the commodities, we are cognizant that according to the EMIS 2019 data, that's the Education Management Information System, which is based on the annual education census, Namibia's schools, only 32% would not have access to the traditional telecommunication. Only 18% don't have access to electricity, 13% don't have access to sanitation, and 11% have no access to water. These 11% translate to 211 schools that would not have water, that is potable water. So there's a plan drawn up to deploy water tanks and the best solutions to make water accessible at these schools. These plans are submitted for costing and then for execution. The same applies to the 250 schools that are without sanitation facilities. At the same time, our directives to the regional directors with the onset of the state of emergency was already capturing the details of those schools that have deplorable sanitation conditions to be included for the immediate renovation and improvement. That means also the access to those 13%, the 250 schools that have no sanitation facilities. So those plans are submitted and they are existing. Regarding the electricity and the telecommunication, that is still to be developed, and with the partnership office to get electricity through solar panels and other connectivities, getting connected to the grid, that is underway. So this gives an indication of the number of institutions, the schools and infrastructure preparedness. Of course, electricity and ICT or telecommunication go close together, but we are also aware of that it's close to 80% that the country is covered through the telecommunication providers. So, of course, they will also continue partnering with us, and we are in dialogue, and my colleague will still elaborate on that. In terms of numbers of learners, of these 804,079 learners, about more than 400,000 learners are primary learners, and only slightly more than the other half is in secondary. So we have to cater for these learners. About 370,000 used to benefit from the Namibia school feeding program. That means they are the most needy learners in terms of socioeconomic circumstances, providing them with one meal a day to enhance their concentration and cognitive abilities for the learning. So at least we'll have to provide for those, the most vulnerable ones. So, but let me assure you, it'll be more than 400,000 learners for whom we wish to cater through the paper and pen mode.
So Ms. Edebon, would the learner package be a way to be able to provide some of those food amenities to those vulnerable learners?
That is one way to access them. Okay. And this is supported together with UNICEF and UNESCO. And we also, in terms of the material production as well as the distribution, we will mobilize all resources that we have, and building, as our Honorable Minister said, building on existing structures, government structures, but also public-private partnerships. I mean, willing partners who are out there who assist us. And we have seen already the print media is active in providing activities, especially for the primary school child.
All right.
So that's it.
Thank you very much, Ms. Edebon. Yeah. Mr. Van Beek, to touch a little bit on
connectivity issues,
yes,
and the involvement of partners that have already joined.
Yes, good morning, viewers and audience. This morning, yes, thank you for the opportunity. In terms of the number of schools that Ms. Edebon has alluded to, is around 620 schools who are not currently having some form of electricity or communication. And as I said, electricity is needed when we're basically looking at issues of connectivity, specifically for our partners like Telecom, to basically issue or provide connectivity to those schools as well. And that plan has already been, mass plan has already been set in motion already last year and the year before last year, where we did a mapping exercise with Telecom in terms of those schools covered under the Telecom umbrella and where they can have connectivity. Seamless to say that with MTC, already with a coverage of 98% of the country, there is some pockets also that is having some challenges where you only find 2G connectivity as well for some schools. We have also sent out a survey to our schools, our teachers specifically, targeting them in terms of asking them questions about how they can be connected, what kind of technology they have access to, and if they have access to internet as well. That form was sent out manually in hard copy, and also a link was provided for them to access, if they could access it, and then fill the questionnaires online. As of this morning, almost 20,300 teachers have accessed that link of us and has completed that questionnaire for us online. We, however, encourage more teachers, if they do have access, to please access that. Now, that is very encouraging for us because we're looking at almost 75% of the teaching fraternity having access to some form of technology. We will do the breakdown in terms of what they're currently accessing, is it via Telecom or is it via MTC? And what is also encouraging is that many of them have indicated that they have WhatsApp already, and they've created WhatsApp groups for their learners as well. So that is also, as I said, very encouraging for us. So that means that there is a form that we can actually reach our teachers. They've provided us, all of us they've all provided us with email addresses that they can be access to. And we've also asked them on the form to give us the WhatsApp address, which they can be accessed via WhatsApp as well. So that we have access to them already. We had an overwhelming response from partners that to support us during this COVID period, pandemic period, in terms of how they can help us to access learners, to access the youth, and to access our teachers as well. I can just name a few of them. Specifically, we have also the support from Namibia Media Holdings in the form of the MyZone portal, where they basically access more than 500,000 people online specifically, which we will make use of providing some communications from the ministry side to these portals as well. The ministry has also opened up the ministry learning YouTube channel, where we are depositing YouTube's videos that we have developed already with NAMCOL and the ministry, and those will be started publishing as of today. We have also the Namibia Broadcasting channel, where the broadcasting of video materials will start with NBC, hopefully by Monday morning, as we are speaking. And then also the radio, and NBC radio, and also our community radios, which will broadcast content online, because those has already been developed, is existing. As we are speaking, the committee is finalizing those that will be sent to the radios this morning, as of this morning, to be broadcasted as soon as they can be broadcasted. The timetable for this one has already been discussed and been set up, so I think this is something that moves forward, in addition to the printing of the learner package that we will do specifically.
Thank you very much,
Yeah.
Mr. Van Beek.
Thank you.
Thank you. All right, ladies and gentlemen, we're about to come to a close to our program. I, however, have an opportunity for one more question, as we'll give then the Minister to conclude. Yes, sir.
Good morning, Madam Moderator, Honorable Deputy Minister, Honorable Minister, Maggie Kashina Monene, a sign language interpreter. My name is Denver Kisting. I work for a Rubrika newspaper. I have two questions for Dr. Thuben Kandetu. Firstly, I'd like to have a very brief update on cases 1, 2, 3, the foreign nationals who've also recovered. Have they been repatriated? Please update us on that. And then secondly, in as much as I share his delight that we've reported no new cases or any deaths, we did learn that someone passed away at a private hospital in the capital last night, and it is believed that it's a COVID-19 related death. We understand that the body has been swabbed. We expect the results to be available tomorrow. Could you please confirm that? Relating to that, we do know that if a person passes away as a result of COVID-19, that the state is responsible for the funeral. But what does the health protocol look like for such a death? Who picks up the body? To which mortuary is it taken? Will the body be cremated or buried? In what time does that need to take place? That's it basically. Thank you very much.
Thank you, Mr. Kisting. Dr. Kandetu, perhaps just 3 minutes to respond to, unfortunately, that sum of questions.
Okay. Thank you very much for those questions. I'll answer your first question regarding case 1, 2, and 3. Yes, you are correct. They are foreign nationals. However, cases 1 and 2 still remain positive, and they have not yet been cleared as having been recovered, so they cannot be repatriated yet. With regards to case number 3, he is one of our recoveries and has been discharged over about 2 weeks ago. So he doesn't necessarily need to be repatriated. His visa, if I understand it correctly, is still valid, and he is still in the country waiting for a fellow traveler of his to also be cleared of the virus. But there's no need to repatriate them once they have been cleared as recovered. With regards to your second question, as I reported this morning, there are no new deaths from COVID-19. So the case you are referring to from Roman Catholic Hospital is still being investigated. The patient was swabbed, was tested, and the test will be run today. But as I mentioned to you, the events that led to her death are still being investigated. So there's nothing to report at this stage. Now, having said that, the ministry does have a comprehensive set of standard operating procedures in terms of in terms of management of corpses. We apply these SOPs in state. We have been doing so for some years now. The SOPs are there. So regarding this case, that is all I can report now at this stage, as the investigation is ongoing. Once the investigation is complete, and once we have results for this case, we will communicate to you through the correct channels. Thank you very much.
Thank you, Dr. Kandetu. Just a moment, ma'am. Thank you. You can just remain there. One question, please, for Dr. Kandetu.
Before you go, you just said case number 1, which I assume is, which is, according to my understanding, one of the Romanian couple. You've just said that this person is still positive, that's why they can't be repatriated. Can you please just, because our understanding was that both these people were cleared, that they tested negative after 2 tests. And then can you also, on the person who died in Roman Catholic last night, according to our understanding, NIP can only put the run through if there are 96 samples. How many samples are there now? When will we have the results? Do we have to wait until we have 96 samples before this person's sample can be tested? Thank you.
Thank you very much. Yes, Dr. Kandetu.
Okay, so thank you again for your question. Regarding the first question, both case number 1 and 2 have not been cleared. What that means is they have not recovered. They still have tested positive. They are still admitted in one of our isolation units.
So perhaps, Dr. Kandetu, who are the 4 recovered? If you could just say by case, perhaps. Maybe that's where the confusion comes from.
So the 4 recoveries are case number 3. Just hold on one second. Case number 3, case number 5, case number 6, and then the latest one now is case number 14. Those are the recoveries.
Thank you very much, Doctor.
You had a second question, ma'am.
Yes, the question was around that now that the tests have been taken of this supposed death that has been related to COVID-19 last night, do we then await only until 96 samples have been tested for that one go of testing, or will we be able to get the results, and when will we get them?
Okay, thanks. So yes, although the machine can take a maximum of 96 samples, NIP does not wait for the entire machine to be filled. NIP tests every single day according to the number of samples they receive. So they do not wait for the entire machine to be filled before they run the test. So I hope that is clear.
All right, so we will get the results when?
So the sample is currently being tested, and the result will first be communicated to the next of kin, because that is
procedure.
That is our procedure, not to the media first. I think that should be made very, very clear. The results will be communicated to the next of kin, and if there's something to report, we will report to the media through the correct channels.
Thank you very much.
Thank you very much.
Much appreciated. Honorable Minister, as we conclude our discussion, we got two questions from viewers. One is around school-related fees or development fund. I think there is still some confusion about that, if parents are obligated to still give some certain fees for a universally free primary education that we have now. That's one. And secondly, it's around questions that if certain teachers have their materials sort of stuck in another duty station or at their duty station while they are in another region, how will they be able to get their materials to where they are? So those are the questions we have received.
Thank you so much, Honorable.
As you now put in your concluding remarks at the end.
Yeah. I laughed about this one. I forgot about the question. The issue of school development fund is out of our vocabulary. Education, we are saying education is free, but we expect parents voluntarily to still do something and contribute to their own learners, to children's learning, depending on what the school boards and the principals and the parents agree on. We still have parents who are doing that, and we expect parents to contribute something voluntarily to the education of their children. Even when they are asked, or even when they are not asked, they can suggest to it. The question of materials being in the duty area and the staff member is somewhere else, hey, that's a tricky one. Definitely, they would have to deal without them, because I don't know if there is any other means, maybe for to be sent by post or something, but that's something.
That's an option.
That's an option that the person, an individual can arrange and see how they can, if there is something that they strictly need. Otherwise, the movement of people are out.
Yes.
Yeah. In conclusion, I would like to say the following. First, whatever we are doing now should be looked at realistically. We are doing many things that we have been doing, but at a pace that we might not be doing now. We are forced to do things at a different pace now, but there are things that we realistically may not say we are going to finalize and finish everything done before the end of the lockdown or before the children come back to school, especially infrastructure related problems. But when it comes to those things that we must have in place to make sure that children are, the hands are washed, they are sanitized and all those things, we are doing everything that we can. But I'm just cautioning that we need to be realistic, pending resources. Whatever we want to do, we need to have resources at hand. The other thing I would like to encourage our teachers and learners. First, the teachers. We have been inundated with our teachers really wanting to move and go to their own duty stations, close to their schools, close to their whatever. But what we are saying is that we as a ministry are guided by the country's stand with regard to the health advice that we get from the Minister of Health. The extension of the lockdown was done with a reason. It was done with a reason for us to be wherever we are, for us to make sure that the minister do whatever they can to crush the spread of this disease, for us to ultimately say we are free. Let them be calm, patient, and innovative and initiative, and think positive, and do whatever they can under the circumstances. To the children, I would say, and the parents, please parents, let them take care of the children. Every time I see the news, I see learners all over. Even here around, last night, a group of 4 people passed my house. While the regulations are clear that even if you are going to walk from the same house, at least up to 3 only. Now it's a group of people passing, and I was like, this is something that needs to be reported also. Parents must take care of the children. You may think you are not, I'm with my child, not infected. You don't know what surface this child is going to touch and start touching all over and the whole family is scared. We don't want these children to come back to schools and infect each other again in schools. Let them take good care of their children. And let us not panic. We should relax. Everything is, nothing is permanent. This situation is temporary. The ministry is hard at work, and our stakeholders, our teachers, they are on board. So my sincere urge is to say, let's just be calm and wait until the situation is over.
Thank you very much, Honorable Minister, for that. Thank you, viewers and listeners, for tuning in as always to our COVID-19 update. I think the Honorable Minister did a good job today, giving an outline of how schools will be reopening and everybody's role in ensuring that learning and teaching continues for our learners at both primary and secondary schools. That is all from us here at the COVID-19 Communication Center. Join us again this afternoon as we discuss further around health-related issues around COVID-19 in the country. Continue to join us on all our updates to be informed about what you can do to constantly try to stop the spread of COVID-19 in Namibia. That is all the time we had. Have a wonderful day. We're about to come to a close to our program. I, however, have an opportunity for one more question, as we'll give then the Minister to conclude. Yes, sir.
Good morning, Madam Moderator, Honorable Deputy Minister, Honorable Minister, Maggie Kashina Monene, a sign language interpreter. My name is Denvikisting. I work for a Rubicane newspaper. I have two questions for Dr. Thuben Kandetu. Firstly, I'd like to have a very brief update on cases 1, 2, 3, the foreign nationals who've also recovered. Have they been repatriated? Please update us on that. And then secondly, in as much as I share his delight that we've reported no new cases or any deaths, we did learn that someone passed away at a private hospital in the capital last night, and it is believed that it's a COVID-19 related death. We understand that the body has been swabbed. We expect the results to be available tomorrow. Could you please confirm that? Relating to that, we do know that if a person passes away as a result of COVID-19, that the state is responsible for the death. But what does the health protocol look like for such a death? Who picks up the body? To which mortuary is it taken? Will the body be cremated or buried? In what time does that need to take place? That's it basically. Thank you very much.
Thank you, Mr. Kisting. Dr. Kandetu, perhaps just 3 minutes to respond to, unfortunately, that sum of questions.
Okay. Thank you very much for those questions. I'll answer your first question regarding case 1, 2, and 3. Yes, you are correct. They are foreign nationals. However, cases 1 and 2 still remain positive, and they have not yet been cleared as having been recovered, so they cannot be repatriated yet. With regards to case number 3, he is one of our recoveries and has been discharged over about 2 weeks ago. So he doesn't necessarily need to be repatriated. His visa, if I understand it correctly, is still valid, and he is still in the country waiting for a fellow traveler of his to also be cleared of the virus. But there's no need to repatriate them once they have been cleared as recovered. With regards to your second question, as I reported this morning, there are no new deaths from COVID-19. So the case you are referring to from Roman Catholic Hospital is still being investigated. The patient was swabbed was tested, and the test will be run today. But as I mentioned to you, the events that led to her death are still being investigated. So there's nothing to report at this stage. Now, having said that, the ministry does have a comprehensive set of standard operating procedures in terms of in terms of management of corpses. We apply these SOPs in state. We have been doing so for some years now. The SOPs are there. So regarding this case, that is all I can report now at this stage, as the investigation is ongoing. Once the investigation is complete, and once we have results for this case, we will communicate to you through the correct channels. Thank you very much.
Thank you, Dr. Kandetu. Just a moment, ma'am. Thank you. You can just remain there. One question, please, for Dr. Kandetu.
Before you go, you just said case number one, which I assume is which is
Hello.
understanding one of the Romanian couple. You've just said that this person is still positive, that's why they can't be repatriated. Can you please just, because our understanding was that both these people were cleared, that they tested negative after 2 tests. And then can you also, on the person who died in Roman Catholic last night, according to our understanding, NIP can only put the run through if there are 96 samples. How many samples are there now? When will we have the results? Do we have to wait until we have 96 samples before this person's sample can be tested? Thank you.
Thank you very much. Yes, Dr. Kandetu.
Okay, so thank you again for your question. Regarding the first question, both case number 1 and 2 have not been cleared. What that means is they have not recovered. They still have tested positive. They are still admitted in one of our isolation units.
So perhaps, Dr. Kandetu, who are the 4 recovered? If you could just say by case, perhaps. Maybe that's where the confusion comes from.
So the 4 recoveries are case number 3. Just hold on one second. Case number 3, case number 5, case number 6, and then the latest one now is case number 14. Those are the recoveries.
Thank you very much, Doctor.
You had a second question, ma'am.
Yes, the question was around that now that the tests have been taken of this supposed death that has been related to COVID-19 last night, do we then await only until 96 samples have been tested for that one go of testing, or will we be able to get the results, and when will we get them?
Okay, thanks. So yes, although the machine can take a maximum of 96 samples, NIP does not wait for the entire machine to be filled. NIP tests every single day according to the number of samples they receive. So they do not wait for the entire machine to be filled before they run the test. So I hope that is clear.
All right, so we will get the results when?
So the sample is currently being tested.
And that concludes today's session where the Minister of Education spoke about the logistics around preparing both teachers and learners for returning to school. She emphasized that teachers must know that they're going back to work and that the holiday is over, as well as for children. The ministry also explained that while they are doing their best to make online materials available, there are a lot of vulnerable children still out there who might not have the necessary resources, electricity or internet, to access online materials, and that they're preparing to print materials to distribute to these children countrywide. And the minister also said there is no certainty yet when the children will be returning to school, although they hope that the teachers might be able to return on the 5th of May. And that's it for today. Thank you.
Thank you.